Okay, in this presentation, I'm going to discuss should type 2 diabetes patients try ketogenic diet to control the blood glucose level. As we know, type 2 diabetes patients shows the insulin resistance, and the previous research shows that a low-carb diet will help to improve insulin sensitivity, and keto diet is one of the low-carb diet. Thus, I want to figure out that first, can keto diet improve insulin sensitivity for type 2 diabetes patients? If the answer is yes, I want to know is the keto diet induce insulin sensitivity improvement independent with the weight loss or not? Also, I want to know that will keto diet induce any other side effect to patients in long term? So, in this research, the scientists collect a group of the type 2 diabetes patients and give them low carbon keto diet for 24 weeks. After 24 weeks, the result shows they got significant improvement on insulin sensitivity. However, in this research, they did not control the body weight. Thus, the improvement of insulin sensitivity induced by keto diet for type 2 diabetes patient could probably because of the weight loss instead of the keto diet itself. Thus, what happens if the weight increase or we control the weight? So when the weight increase with the keto diet or high-fat diet, the result shows that the insulin-stimulated glucose uptake for ELD muscle and epi muscles is actually decreased for high-fat diet in these pictures. And if we control the body weight at the same, it shows the same thing that the high-fat diet will lead the insulin resistance instead of the insulin sensitivity. Thus, we can wrap a conclusion that once we control the weight change, the result shows that the keto diet will not improve the insulin sensitivity for type 2 diabetes at all. On contrast, the high-fat food intake structure would even lead insulin resistance. But why? There are a lot of different theories try to explain this, but I think this research make a lot of sense for me. The accumulation of ceramide led by high-fat diet could lead insulin resistance. Once we start the high-fat diet, the accumulation of ceramide will increase inside of the body as this figure shows, and the ceramide accumulation would induce the insulin resistance. Here is the mechanism. Once the ceramide increase, it will activate PKC zeta and inhibit the AKT pathway. It could also activate PP2A and dephosphorylate AKT. Once the AKT has been dephosphorylated, the AKT pathway will not work, and this will induce insulin resistance. And as for the last question, yes, the keto diet will induce other side effects to patients in long term, for example, the cardiovascular disease and hepatic inflammation. Thus, in conclusion, keto diet is not the best option for type 2 diabetes patients to regulate their blood glucose level due to the side effect and the lead of the insulin resistance. Here is the reference list, and thanks for watching.